Everyone. In this session, we are going to discuss a very important topic, that is hereditary spherocytosis. This topic is ultra important and little bit difficult to understand, but I will make a cakewalk for you. So usually you get a long question as well as short question on hereditary spherocytosis. So let's start it. We are starting the topic, that is hereditary spherocytosis. So first of all, I will let you know the overview. First of all, I will let you know the introduction. What do you mean by hereditary spherocytosis? Then we will see its pathogenesis, and finally we will see its lab diagnosis. So let's start it. So let me tell you the introduction of the hereditary spherocytosis. So as the name indicates, it's hereditary. It's a disease which is hereditary. So we have to tell the inheritance. Whenever there is a hereditary disease, we have to tell the inheritance. So here the inheritance is autosomal dominant. It is a disease which is showing, it's an anemia which is showing autosomal dominant inheritance. Now what is the problem here? The RBC membrane will become abnormal, because of which the shape of the RBC will become abnormal. What is the normal shape of the RBC? You can see from the top view, the RBC is circular in shape. RBC is circular in shape, having a diameter of 7.5 micrometer. But if you see from the side view, the top view is like a coin. But if you see the side view, you can appreciate this coin is uniform everywhere. But you can appreciate the RBC is not uniform. You can appreciate here in this three-dimensional image, you can see the video. So here the side view, the RBC is biconcave in shape. So that is the normal shape of the RBC. Now what is the abnormality here in the shape? Let me tell you. For that, for understanding the abnormality in hereditary spherocytosis, first you have to understand the normal cell membrane of RBC. So let me tell you where is the normal cell membrane of the RBC. Here you can see this is the RBC cell membrane. So let me draw the cell membrane of the RBC and let me explain you the name of the proteins which provide biconcave shape to the RBC. Now in this cell membrane, you can see two proteins are present in the cell membrane, which are known as transmembranal protein. So one is band 3, you can see this one is band 3, and the another one is glycophorin A. So this one, the second one, the another one. So this one is known as glycophorin A. So these are the two proteins which are present in the cell membrane of the RBC. So these are known as transmembrane protein. Now just below the cell membrane, there is another protein. There are two chains which is known as spectrin, the alpha chain of the spectrin and the beta chain of the spectrin. You can appreciate the two chains of the spectrin protein. So we have cell membrane, the two transmembrane protein band 3 and glycophorin A, and we have spectrin. Now there are two connectors are there. There are two connected proteins. I want to connect the cell membrane with the spectrin. So two connectors are there. So band 4.2 and ankyrin, these are connecting band 3 with the spectrin, and band 4.1 and actin, these are connecting glycophorin with the spectrin. So you have understood the name. So we have two transmembrane protein, one is spectrin, and 4 are connectors. So 4, 5, 6, 7. Total 7 proteins are there which provide the biconcave shape to the RBC. So we can see the shape of the RBC, the healthy RBC, the normal adult RBC, it's biconcave. It is due to these 7 protein. I will draw it for you, don't worry. So let's draw a cell membrane of the RBC. This is the cell membrane. Okay, here I am drawing the cell membrane of the RBC. Now in the cell membrane, first of all, I will draw the two transmembrane proteins. So here I am trying to draw the two transmembrane protein. These are known as transmembrane because they are present inside the cell membrane. This one is known as band 3 and this one is known as glycophorin A. Band 3 and glycophorin A, the two proteins. Now just below that, just below the cell membrane, we are having two chains of spectrin, the alpha chain of spectrin and the beta chain of spectrin. So the two chains of the spectrin. Now I want to connect the cell membrane with that of spectrin. So I need connectors. So 4 connectors are required. Let me highlight the 4 connectors. 2 are required here, connecting the band 3 with the spectrin, and 2 are required here, connecting the glycophorin A with the spectrin. So what is the name of these connectors? So here it is band 4.2 and ankyrin. Band 4.2 and ankyrin connect band 3 with the spectrin, and here it is band 4.1 and actin. So band 4.1 and actin connect the glycophorin with the spectrin. So these are the 7 proteins. Can you name them? What are the 7 proteins which are responsible for biconcave shape of RBC? So it's band 3, it's glycophorin A, it's spectrin, and the 4 connectors, 4.2, ankyrin, 4.1 and actin. So that is the various proteins, the total 7 proteins which are responsible for biconcave shape of the RBC. Among them, if I ask you one protein, the most important protein which is responsible for biconcave shape, so answer is spectrin. The answer is spectrin. Now let me tell you the disease.